Welcome back guys. Now in this video, let's discuss about ventilation perfusion ratios. Okay, ventilation and perfusion, the ratio of ventilation perfusion. Now we have discussed what is the ventilation. We have discussed about different types of ventilation. What are they? Alveolar ventilation. We have discussed about dead space ventilation and minute ventilation. And also we know what is the perfusion. Perfusion is the amount of blood going to the lungs for the purpose of oxygenation. Now what is the alveolar ventilation perfusion ratio? The ventilation perfusion ratio is V by P or V by Q. How much ventilation is happening into the lungs? Sir, the real ventilation, alveolar ventilation is 4200 ml. Now, let's take it as round figure. 4 liters of air is entering into the lungs for the purpose of gases exchange. And how much blood is coming to the lungs? 5 liters. So, 4 liters is the alveolar ventilation, 5 liters is the perfusion. So, 4 by 5 is 0.8. So, V by Q ratio or the ventilation perfusion ratio is 0.8. But important point is the ventilation perfusion ratio is not 0.8 throughout the lungs. It is 0.8 in the middle lobes, average. But in the apex, it is different. In the base, it is different. Previously, we have discussed, right? In the apex of the lung, what happened to perfusion? Perfusion is less. In the base of the lung, what happened to perfusion? Perfusion is more. So now let's see here. Let's first discuss about the apex of the lung. Sir, in the apex of the lung, what is the ventilation and what is the perfusion? Please look at this image. Just look at this image. In the apex of the lung, the alveoli are bigger in size. In the base of the lung, if you are going down to the lung, in the base of the lung, alveolar size are smaller in size. Having said that, see, in the apex, what happens about the ventilation? The alveoli are larger in size, big alveoli. You cannot further stretch them. Already they are big. You cannot further stretch them. So what about the ventilation? Ventilation is less compliant alveoli. As they are less compliant, air is not going in. Okay, even if it goes, little air goes. Why? Because they are less compliant. So larger alveoli are seen. They are less compliant and less ventilation is seen. Now look at the perfusion now. Okay, now just stop here and look at the perfusion. Perfusion is having higher resistance. Okay, there is higher resistance for the flow of blood. Previously we have discussed in the previous, last video. The perfusion in the apex of the lung is less. Why? Because the alveolar pressures are more than the arterial pressures. So that's why the blood vessels are compressed. So less blood flow is there, less perfusion is there. Now my point is, see, in the apex of the lung, ventilation is less, no doubt. Perfusion is also less. Okay, ventilation is less, perfusion is also less. But if you compare them, head-to-head comparison, ventilation is greater than the perfusion or perfusion is less than the ventilation. Important. In the apex of the lung, ventilation is not like 0.8. Ventilation is not 4. Perfusion is not 5 liters. Ventilation is not 4 liters and perfusion is not 5 liters. Okay. Here, in the apex of the lung, ventilation by perfusion ratio is not 0.8. Then how much? Sir? Now let's see. In the apex of the lung, if you look at the gases exchange, there will be less gases exchange. Why there is less gases exchange? Why? Because first of all, the ventilation is less, no doubt. Even the perfusion is there, less. Okay, no blood is going there. If no blood goes there or very little blood goes there, there is no one to take the oxygen. So what happened to the oxygen tension in the apex of the lung? In the apex of the lung, the oxygen tension increases, the partial pressure of oxygen increases. Why? Because there is very less blood flow coming there. So more oxygen is available in the apex of the lung. That's the reason why Mycobacterium TB infections will affect the apex of the lung because of availability of high amount of oxygen. Mycobacterium TB is aerobic organism. It needs oxygen for its survival. So Mycobacterium TB affects apex of the lung. In the apex of the lung, there is high partial pressure of oxygen. There is less gases exchange. Why? Because there is no perfusion or very little perfusion. Now, look at the base of the lung. In the base of the lung, already we know one thing. So, the perfusion in the base of the lung is more. Perfusion is more, no doubt. Also remember, in the base of the lung, the alveoli are smaller in size. If they are smaller in size, you can further stretch them. If you can further stretch them, more blood will come. So, see here, in the base of the lung, Let's talk about the ventilation. Alveoli are smaller in size. Now as they are smaller, you can further stretch them. So more compliant alveoli, more ventilation can happen. As more blood is coming, more gases exchange will happen. Okay, more gases exchange will happen. So what I am trying to put into your mind is, in the base of the lung, ventilation is more, no doubt, because alveoli are more compliant, and perfusion is also more. Ventilation is more as well as perfusion is more. But if you compare them head to head basis, now perfusion is more than the ventilation, or I can say ventilation is less when compared to perfusion. Okay, when compared to perfusion. Okay, so these are the points which I want you to know. But at the end of the day, see this, as we move from apex to base, what happens? Both the ventilation increases, perfusion increases progressively. In the base of the lung, both ventilation is more, perfusion is more. But if you compare them, ventilation is less than the perfusion in the base. In the apex, ventilation is greater than the perfusion. Now let's see, in the apex, what is the V/Q ratio? It is not 0.8, now it is 3.2, which means now more oxygen availability is there. More the V/Q ratio, more the oxygen availability. Okay, so the V/Q ratio in the apex of the lung is 3.2. Large alveoli, which are less compliant in nature. In the apex of the lung, ventilation is greater than the perfusion. As ventilation is more oxygen availability is there. That's why Mycobacterium TB mainly affects upper lobes due to more availability of oxygen. Now let's look at the base of the lung. In the base of the lung, V/Q ratio is not 0.8, it is 0.6, which means less partial pressure of oxygen. Less partial pressure of oxygen is there. Why? Because there is good blood flow. Okay, rapid exchange of gases is happening. So smaller alveoli, more compliant alveoli, ventilation is less than the perfusion, which means more blood is going than the amount of air coming. Okay, than the amount of air coming. Now let's discuss about conditions where the V/Q mismatch will occur. So ventilation and perfusion are getting mismatched. For example, in the example number 1, see V/Q. Ventilation is good. Okay, ventilation is normal, but perfusion is affected. Okay, ventilation it's normal, that is 4. Okay, ventilation is normal, so here I am keeping 4 liters. But perfusion is getting affected. Perfusion is becoming 0, means no blood is going to the lungs. Perfusion is affected. So what happens? Sir, air is going, but no blood is coming. So that air, whatever have entered there, it is wasted away, right? Simple. So wasted ventilation. Ventilation is wasted away. Now what will happen? 4 divided by 0. If you divide any value by 0, the answer will be infinity. Now tell me, V/Q mismatch is infinite in which conditions? In the conditions where the perfusion becomes 0. In which conditions? Like pulmonary embolism. In pulmonary embolism, the V/Q mismatch is infinity. Okay, the V/Q ratio is infinity. Okay, and even in anatomical dead space, sir, in anatomical dead space, what happens? In the anatomical dead space, ventilation is there, no doubt, but there is no blood going there to the conducting zone. No blood is going to the conducting zone for the purpose of gases exchange. So even physiologically, you will have V/Q ratio as infinity in the anatomical dead space. Now let's discuss about other condition, other V/Q mismatch where ventilation is affected but perfusion is normal. Now ventilation is affected but perfusion is good. Now see, ventilation is becoming 0 but perfusion is normal, 5. So 0 divided by any number. Okay, if you divide 0 with any number, it will be 0. 0 divided by 5 is 0. Okay, so what are the examples in which ventilation is affected? Ventilation is affected in foreign body obstruction. If there is a foreign body obstruction, automatically the amount of air that will go there will be affected. So ventilation is affected, one thing. In atelectasis, what happens? In atelectasis, there is complete collapse of the alveoli. Alveoli are collapsed, so no air is going there. Ventilation is affected. Now if you have any tumor, if the patient is having any tumor, the tumor is compressing the airways, goiter, or some cancer which is causing the compression of the airways. So ventilation is affected. So ventilation is affected means the V/Q ratio will become 0. Okay, so these are the conditions in which the ventilation perfusion are going to be mismatched. Okay guys. the topic is completed. Hope the video is helpful. In the next video, let's discuss about diffusion and transport of gases. Thank you.